Hello, my name is Hayden Muntz, and this is going to be my healthcare policy and law presentation. This is also my fourth attempt since I've been hitting the max time on the recording program that I am using. So I'm going to try to keep this as short and sweet as possible for you. Through this presentation, we will be going over what is health policy and law, the importance, the domains of health policy and law, identifying the problems, public and private policy and the differences between the two, how policy and laws are made, and why they are needed. So what is health policy and law? I think as citizens and employees or employers, we all have a general understanding of what policies and laws are, especially if we drive cars. We've all had to put on our seatbelts. We've all had to abide by the speed limits. Maybe we've even been pulled over. So we all have a general understanding of policies and laws. If we have been employees at companies, we know that they have specific policies and laws that they implement according to their company or organization and the things that they do. So within healthcare, these policies and laws are decisions that are made to change and influence behavior in relation to health. This is defined by our text as shaping the behaviors of individuals and industries, the practice of healthcare, the environments, and achieving public health improvements. So, these policies and laws really shape all aspects of healthcare, which include the structure, organization, the delivery or the receiving of healthcare, and the financing, whether it's the providers or organization providing for the services or necessary tools and resources that they need, or the patients financing the services. These policies and laws also influence organizations, groups, and even individuals. So why are they important to healthcare? And I think, as I said before, since we all have this general understanding of what policy and laws are in general, we know that companies and organizations, they make them for safety, keeping their employees safe, keeping their consumers safe. And it's the exact same thing in healthcare. We want to keep our providers safe, the organization safe, and the patients safe. This also includes combating public health threats. The federal government usually takes the lead on combating public health threats, whether it's massive vaccinations or diseases, things such as that. And it's also, they're important because they create a balance between public regulation and exercising rights. The federal government and state government have different policies and procedures that they can create. And it's important that they are able to regulate each other so that they are also able to exercise the rights, and it's not just one government completely overriding and completely drowning another state or individual or group. These policies and procedures also define the functions and the power of the federal government, state governments, and organizations, and what they can do and provide for the people. And they also have policing powers. And these policing powers are defined as the inherent authority of state and local governments to regulate individuals and private business in the name of public health promotion and protection. So these policies are able to be overridden in order to keep people safe. So We know that policy and laws, especially in healthcare, is still a ginormous group and category. And our text defines or breaks healthcare policy and law up into three domains, which is healthcare, public health, and bioethics. Healthcare is related to the individual and the individual's access to care, their quality of care, and then also the finance side of their care. Public health is a broader category where it covers the government regulations for protecting health, safety, and the welfare of the public. This could include blanket policies, such as, like we stated before, vaccine policies or even healthcare reforms. And then bioethics, which I think right now in today's society is a massive issue as it relates to the ethical issues within medical practice. So this is the biggest thing that politicians will focus on, especially with the debates that are happening in the election cycle that is currently happening. Bioethics is really in order to gain the public support, because everybody has different law or morals and values, and bioethics is where these policies and laws and morals and values intersect. So the people are going to follow wherever their morals and values lie. So after the domains of healthcare and policy and law, we see that there are two other categories, which is the public and private side of healthcare and policy. Policy and law. We have the public side, which is just established policies by the federal, state, and local governments. They have the potential to create laws. They vary from state to state and from federal. So this, as an example, is state licensing or state licensing. There's different state licensing for nurses in particular, and even like medical assistants. They are created and voted upon within the eye of the public. And there's a quote, and it says, they're ultimately made by governments, even if the ideas come from public interaction. And then in general, they just address public policy or health problems. So it's public policy and law is just on a much larger scale. And then the private side is where they are established by individual or private organizations. They're not limited to the judicial processes. They're often created behind executive doors or outside the public view. Within organizations specifically, they serve as a resource for staff and facilities, adherence with other professional practices, and then they just reduce human errors and oversights. So problems with policy and law. One of the issues in our text, it says that the government intervention is not always the solution. Even if it's a public policy problem, government issue may not always be the solution. Private organizations or private entities might have a much better solution in order to solve a specific problem, especially if it affects them in a certain way. Laws may not always be in the favor of the public. These policies and laws could be created for different interests, like economic interests of a private company, political interests, or financial interests. They don't always have to please or cater to the public. There's a significant amount of variation, especially from like state to state. We can see the variation there. By Hodge, we see he states that timing, agenda setting, predictable misuse, and politics are all major problems with policy and law. And the timing really addresses or is relates to the assessing policies after they were created. If companies or organizations are trying to fix an issue right away, they might implement a policy very soon after without assessing it until it's created, and that could create a lot more issues for the company or organization down the line. The agenda setting relates to the widespread policy surveillance. So that's just about the thousands of different policies that are out there for the thousands of different companies. And it would take a absurd amount of surveys and studies on these specific policies to really see their effectiveness and whether or not they should be implemented or not to fit a specific agenda. Predictable misuse is related to exemption policies. These exemption policies are like vaccination exemptions if somebody does not want to be vaccinated, and those could really lead to just worse outcomes. And then also politics is an issue just from the failure to properly understand or organize existing laws. So how policy and laws are made. Public policy and law starts with Congress. They introduce a bill, and then it proceeds through a number of steps, ultimately to be proposed to the president, where he can either sign or veto the bill. And private is really much simpler in terms of steps, where it's created by non-governmental organizations, which are defined as commercial insurance companies, private employers, or even influential individuals. And they're just created by groups or individuals with the power to implement decisions. So we see that private policy is really focused on the organization and these individuals that are able to make them. So all in all, why is it needed? I think we can kind of understand, especially through the importance of policy and procedures, why they are needed. But Leahy states that the purpose of healthcare policy and procedures is to provide standardization in daily operational activities. This is just to help employees and organizations deliver the same quality care that is both safe and effective. It's to ensure that these companies are abiding by the specific rules for the specific locations and patients that they are serving and the employees that they have. They're needed because healthcare is a rapidly changing environment with new healthcare reforms and policy changes. They are needed to implement new and reformed policies and procedures to adapt to the specific environment. And then also it just mitigates risk on organizations. It helps these organizations abide by the rules and remain within compliance. And that is all for my presentation on healthcare policy and law. I hope you enjoyed the information that was presented, and I hope it was clear and concise. And have a good day.